North Carolina and all over the country, people are waiting hours in line to get their COVID-19 vaccination.
And while the demand is high, there are reports of unused vaccines. And in California, of vaccines being thrown away. New at 11, CBS 17's Maggie Newland spoke to Duke's head pharmacist about how much vaccine has been lost and beating the clock to make sure every dose gets used. Maggie.
Angela, for many pharmacists, Pfizer's COVID vaccine is one of the most complicated they've ever dealt with. It is also one of the most important, which is why they are working so hard to make sure it doesn't go to waste.
Between the time Pfizer's COVID vaccine leaves the ultra-cold freezer and the time it's injected into someone's arm, several steps must be followed precisely.
There are many different factors that go into the preparation and administration point where there are errors that could take place.
Duke Health System's most recent numbers show just less than 0.5% of their vaccine, 0.4%, has gone to waste.
Yeah, there's probably multiple different reasons, whether it's the preparation that was made, pulled into the syringes, maybe the dosing may not have been 100% accurate. So if there's any lack of confidence there, we would call that dose to be discarded.
While Kuldeep Patel says it's difficult to eliminate all human error, his team is working to do everything possible to keep vaccine from being wasted. That means making sure no doses are left over at the end of the day.
We're continuing to get better and better at predicting what our anticipated needs are.
Once the Pfizer vaccine is ready to be injected, it doesn't last long.
At that point is where the time clock starts, which gives you 6 hours from that point of preparation to the point of administration.
If there are any doses left due to canceled appointments, Patel says plenty of people are willing to get a last-minute shot.
So we have maintained lists of individuals, whether it's patients in the community or our healthcare workers who are eligible to receive the vaccines, to be able to call upon them to make sure that we don't waste that supply.
Now, other Triangle Hospital tells me they are also able to fill any canceled appointments very quickly. They say that's one of the advantages of having an appointment-only event rather than a first-come, first-serve event. It gives them a better idea of how many people will show up and how many vaccines they will need. Reporting live, Maggie Newland, CBS 17 News.
Maggie, thank you.